One of the biggest risks that older women face is widowhood. So only 44% of women 65 and older are currently married today. That's compared with 75% of men. So women are more likely to be widowed because they tend to live longer than men. So we have about 42% of women today are widowed. If we look at the share of women who are in poverty or near poverty, that is those with incomes below 125% of the poverty level, we see that 28% of unmarried women 65 and older were in poverty or near poverty in 2008, compared with only 8% of married women. They lose some of their Social Security benefits when their husband dies. If they were receiving pension from their husband's old employer, they're going to lose at least some of that, maybe all of that, but certainly some of it. And that's going to be enough to push them into poverty or near poverty. About 30% of women 65 and older describe their health as being only fair or poor. About 2/3 of them have a serious health problem, like a heart condition, cancer, stroke, diabetes, serious lung problems, or serious psychological problems. So 2/3 have at least one of these conditions. We look at what are some of the more common conditions. Arthritis is more common among women than men. About 4/5 of women 65 and older have arthritis. Mental health problems are common. 1/4 of women are depressed, older women 65 and older. That's much higher than for men. And even among certain conditions that we think of as being more male problems, like heart disease, are surprisingly common among women. So 35% of women 65 and older have been told that they have a heart problem by their doctor. Another big problem that older women face is disability. Among all women 65 and older, about 1/4 report they have at least some difficulty with basic personal care, performing basic personal care, or with performing household chores. Over a lifetime, over the span of old age, about 80% of women are going to develop some kind of long-term care needs. This is a problem for lots of reasons, but also particularly for financial reasons. There's no real good system we have of providing long-term care. We don't have a good insurance system. Many people don't qualify for assistance from the government unless they've spent down all their money, then they can get Medicaid. Medicare doesn't cover a lot of services. Few people purchase private long-term care insurance. One of the big changes we've seen over the past 25 years is employment. More and more older women are working today than ever before. So about 14% of women 65 and older are in the labor force, that is that they're looking for work or they're actually employed. In 1985, about 25 years ago, that number was only 7%. So it's doubled over just this 25-year period. If we look at the youngest old people, people 65 to 69, 27% of those women are participating in the labor force in 2010. 25 years earlier, in 1985, it was only 13.5%. Divorce is something that many older women today did not face, was not a risk that they faced when they were younger, but the women moving into retirement are more and more likely to have been divorced and to actually enter old age as a divorced woman who is not remarried. That, of course, means that they don't have the financial support, the emotional support of a husband, so that's a concern. And then health status is another thing that's changing that's potentially important. What we've seen over the past 30 years is a big decline in the share of women and men with disabilities at older ages. That means that we've seen there's fewer people in nursing homes today than there were in the past, which is a great development. There is some concern about how that's going to evolve in the future. The biggest risks that women face are low income and long-term care. And so I think those are the areas that we can really focus on to try to improve older women's well-being. One thing is Social Security. Social Security is really paramount. Particularly unmarried women are very dependent on Social Security. And so as we're having this public debate now about Social Security's long-run financial problem and how we're going to solve it. One of the aspects of the proposals that we're talking about is to actually strengthen some protections for low-income people, particularly low-income women. So that's part of the debate. I think that's important. For example, we could institute a minimum benefit to Social Security to prevent people from falling into poverty as they get older. There's another program that is kind of overlooked in all of this, and that's the Supplemental Security Income Program, SSI. This provides limited benefits to very low-income people who are older, 65 plus, or with disabilities. And over time, it really has provided less and less protection to older people. And that's because the eligibility rules have become increasingly strict, so that you can't have more than $2,000 in wealth to qualify for this program. That was basically the same eligibility criteria that existed when the program began about 40 years ago. And so it hasn't adjusted for inflation. So if we were to improve this program, to update it, it could provide meaningful protection to low-income women, which it really doesn't now. Fixing the long-term care problem is important. So creating policies that would provide people with benefits, thinking about how we can get more people insured, providing more supports to family caregivers.